Hello, we are going to be covering chapter 1 in your pathology book today, and this is the introduction to pathology. It has a lot of pathology terms, so it's important that you understand what these terms are because we will be using them throughout the whole book. And it's important that you be able to keep up when I say the difference between a sign and a symptom or a prognosis. So make sure that you study and know all of the terms. Be able to look at their learning objectives and be able to answer what they are. So, for example, describe the different types of disease classifications. We're going to cover that. It's important that you understand what those are. All right, so here's your terms. There's a couple pages of them, so make sure that you do flashcards for these so that you have them memorized. All right, so when we talk about disease trends, usually we're talking about mortality rates. So it's the average number of deaths caused by a particular disease within a population. So the NCHS, National Center of Health Statistics, keeps track of all of that. So they monitor and report mortality rates in terms of leading causes of death by gender, race, and age. So they look at the patterns and the medical interventions that are happening, and the mortality rate actually changes and evolves, and is changing and evolving, going from typically people would die from cancer, and now people aren't dying from cancer at the rate that they were 20 years ago due to the advances in technology and medicine, where now people are dying from, accidents or chronic illnesses. So we look at the mortality rate here. It's the incidence of sick sufficient to interfere with an individual's normal life. And if you'd like, you can take a look at the CDC. They also publish all of the causes of death, which is actually kind of fun to look at. It gives you the number of stabbings versus gunshot versus car accidents. So it's kind of fun to look at. So if we look at the life expectancy, as you can see, these graphs, they're going up, which is great. So people are living longer, but they're living longer with chronic illness. So they're not dropping dead at 40 from a heart attack. We're living longer. Our cars are safer. We have airbags and seat belts, so there's not as many deaths by accidents. So our life expectancy is going up. And the women are outliving the men, which is interesting. So, healthcare resources. There's a lot of changes in the healthcare delivery system, and as we advance in technology, especially in radiology, we are able to diagnose and treat patients so that they can live longer. There's ambulatory centers versus inpatient versus outpatient versus whatever. So, home care, there's a lot of different avenues for patients to be treated. Now, one interesting thing is back in 2014, they looked at the expenditure for healthcare. It was at $3 trillion. It's crazy. And we have one of the worst outcomes out of all countries. So kind of interesting that we spend the most on healthcare, but yet have the worst outcomes. Anyway, so major sources of healthcare funding. The major source is Medicaid services, which is Medicare, Medicaid, and there's the privately funded. So those are the three main ones. The Affordable Care Act has come into play in the last few years. A lot of people call it Obamacare. It's not Obamacare. It's the Affordable Care Act. I have to keep correcting my husband on that. And it is providing subsidized health care for people. So if they can get preventative medicine before they get really, really sick, they can get something cured before, let's say, a common cold that goes to pneumonia. If we can treat the flu before they're hospitalized, that's the key. So having them go in and get a yearly check instead of going to the ER and using the government funding. I like the idea. It's got flaws. I hope and pray that they are able to fix it, because once you jump into this field, you're going to see that our ERs are filled up with people with things that can be seen in a normal doctor's office. So that's very frustrating. I'm just looking at a graph here. This is the national health expenditures in 2015. So you can see hospital care versus professional services, and then you have your net costs and everything. It just gives you kind of an idea where the money is being spent, that $3 trillion. All right, so emergency room visits. As you can see here, they're still going up, but also our population is going up. So this doesn't take into account that, which I think is interesting. But people are going to the ER if they have a broken fingernail. I'm being sarcastic, but yes, the ER visits are going up, and that's the problem, is that we need to reduce the ER visits, send them to urgent care, having them be able to be seen by their doctor. A lot of times, if they don't have insurance, in order to use the government assistance to pay for their care, they have to go to the ER. So hopefully we can reduce this trend. All right, so there's a human genetic technology, and I'm going to go over it and just so you have an idea what's happening. So it's a human genome project. So it went through 2003, and it was coordinated by the U.S. Department of Energy and National Institute of Health, NIH, and they did a genome project. So 50,000 to 100,000 genes are located on approximately 3 billion pairs of DNA and form the basic unit of genetics. Now, there's physical mapping, which is the physical location of a particular gene on a specific chromosome. Then there's genetic mapping. It's used to assign the distance between the genetic markers linking a specific chromosome, and then you have your single nucleotide polymorphism, which is SNP, much easier to say, DNA patterns sequence, and common patterns of genetic variations of a single DNA base. Then there's haplotype, which is a hapmap. It's closely linked SNPs on a single chromosome, identifying specific DNA sequences affecting disease, response to pharmaceuticals, and environmental factors. Now, the thing that's really important to know is that disease starts on usually changes within the DNA. So they're taking a look, and even with the hapmap, so they're taking a look at, does the chemotherapy that we're giving the patient work? So this whole genome project has been revolutionary in changing the way that we're treating patients. And if you're interested in this, you can take a look at it as the mapping of genes to chromosomes, so you get an idea how it works. If we look at the altered cell biology, as you can see on the top, we have a normal nucleus. And then if we go into atrophy, you can see how it's shrunken down. If we go to hypertrophy, you can see it's bigger. So atrophy smaller, hypertrophy bigger. Hyperplasia means that it's growing at an abnormal rate. It's multiplying. So as you can see here, there's more of them than there are here. And then we go into metaplasia, where it's reproducing at a rapid rate. And then there's dysplasia. And dysplastic or dysplasia cells are reproducing at an abnormally high rate, and they're not of normal cell. All right, so you can see here we have a normal cell, and it can adapt to the changes within the DNA. Or it can go to irreversible cell injury, and this can be from a multitude of different things. So we're going to go through all the different types of cell injuries and the pathological process. And so it can adapt again with cell injury and go back to a normal cell, or it can go to cell injury and it can cause cell death. So the problem is when we go here and we have some kind of cell injury, so if it's from radiation or chemicals or whatever it is, and it adapts but changes the DNA, that's where we're getting our cancers and abnormal growths from. All right, so let's get into it. So a disease is defined as the pattern of the body's response to some form of injury that causes a deviation from the variation of normal conditions. So it's a change in the cell from injury. So the disease classifications, there's congenital and hereditary, inflammatory, degenerative, metabolic, traumatic, and neoplastic. With congenital, it's a disease present at birth and results from genetic or environmental factors. It's estimated that 2 to 3% of live births show one or more congenital disease. The major category of congenital disease is caused by abnormalities in the number or distribution of chromosomes. And as you know, an example of that is Down syndrome. Hereditary is caused by developmental disorder genetically transmitted from either parent to child through abnormalities of individual genes and chromosomes. One example is hemophilia. So hereditary disease result from an abnormality in the DNA. They pass from one generation to the next generation, to the next in genetic information contained within the nucleus of each cell. So let's go through the summary of hereditary diseases and the terms and the definitions. So hereditary disease, genetic information contained in the nucleus of each cell passed to the next generation. There's autosomes, so there's 44 chromosomes other than the X and the Y. Dominant genes always produce an effect. Recessive genes manifest themselves as when a person is homozygous for that trait, and mutations is alterations in the DNA structures that may become permanent or hereditary changes. All right. So disorders of immunity. There are three types of immune reactions. As you know, there's anaphylactic, cytotoxic, and delayed. So with anaphylactic, we've all heard of this. This is the most serious. It's where antigens are attacked by the body's previously bound to the surface, antibodies previously bound to the surface of mast cells. So it's generalized by hypotension, shock, hives, bronchial spasm, laryngeal edema. This is the most serious. Usually you need epinephrine to reverse this. The patients can die from an anaphylactic reaction. Cytotoxic reaction is antigen is component of a cell or attaches to the wall of a red blood cell, white blood cell, platelets, or vascular endothelial cell, and it causes lysis or phagocytosis. And there's delayed. So individual previously sensitized to the antigen. So an example is poison ivy, tuberculosis. Autoimmune disorders. So it's a disease in which the body forms antibodies that injure the patient's own tissues. So autoantibodies, and an example of that is rheumatoid arthritis. Is where the body is attacking itself. Not good. All right, here's some of your terms for your immune disorders. There's antigen, which is a foreign substance that invokes immune response. Antibody, immunoglobulin response to the antigen, makes harmless. You have immune, protected against the antigens, antibodies, binding with agents to make them harmless. Active immunity, forming antibodies to counteract an antigen by way of vaccine or toxoid. So that's what I have you guys do. We check for active immunity and all the different lab tests that we had you do. Vaccine, contact with dead or deactivated microorganisms to form antibodies. A toxoid is treated toxin with antigen powder to produce immunity by creating antibodies. Anaphylactic reaction is hypersensitivity reaction resulting in a histamine release. So you're going to give an antihistamine. Standard precautions. So protection utilized when delivering healthcare service to anyone, any person. So we use standard precautions for everyone. We assume that everybody is infectious. So there's personal protective equipment, which we call PPE, and that's your gowns, gloves, masks, shoe covers, eye protection, used to prevent transmission of infectious agents to us. And there's transmission-based precautions, so additional protective equipment to prevent the spread of highly infectious pathogens through contact, droplet, or airborne. All right, so we're going to go into inflammatory reactions now. So it's a generalized pathological process that is nonspecific to the agent causing the injury. So there's local and systemic effects. There's capillary dilatation, increased capillary permeability, cellular necrosis, and phagocytosis. So if we look here, and you can have cell death due to physical injury, chemical injury, or microbial injury. So you have cell death, which produces cell necrosis. And you can have capillary dilatation with increased blood flow. You can have increased capillary permeability where fluid is leaking out. You have attraction of leukocytes. and a systemic response with fever. So you have heat, redness, tenderness, swelling, and pain. There's chronic and acute inflammation. So chronic is damage caused by injurious agent, may not be result of necrosis, long duration of inflammation. You have acute where you have heat, redness, swelling, pain, loss of function, and elevated body temperature, and it comes on quick. Inflammation is defined as the initial response of the body's tissue to local injury. There are 5 signs. There's rhubarb, which is redness. You have heat, swelling, pain, and loss of function. You have tissue regeneration. You have variability of tissue regeneration depending on what kind of tissue and the cell type that is inflamed. You have scar tissue, debridement, repair process, remodeling. And events that occur in the inflammation response. I like this slide. Number 1, it has alterations in blood flow and vascular permeability. Number 2, migration of circulating white blood cells to the interstitium of the injured tissues. You have phagocytosis and enzymatic digestion of dead cells and tissue elements. And number 4, repair of injury by regeneration of normal parenchymal cells or proliferation, granular tissues, and eventually scar formation. So you have infection, and the infection can occur without the infection. Inflammation can occur without infection. Whew. All right, so we're still in inflammatory, and you have a disease that results from the body's reaction to a local injurious agent. So you can have an infective disease, invasion by a microorganism. You can have toxic disease, which is poisoning by a biological substance, or you can have allergic disease, which is an overreaction of the body's own defense. And one of the examples of that is pneumonia. And your summary of terms for your inflammatory process. You have inflammation, initial response to tissues of local injury. You have permeability, membrane, allows fluids or cells to pass from one tissue to another tissue location. You have granular tissue. You have fibrous scar replaces destroyed tissues. Pyrogenic bacteria, thick yellow fluid caused by pus, dead white cells. You have abscess, localized, usually encapsulated collection of fluid. And you have bacteremia, which is a potential involvement of other organs and tissues in the body organisms invading the blood vessels. So that's where people get septic. So infectious disease exposure. Healthcare professionals are at an increased risk. So you need to use your standard precautions on everybody and personal protective equipment, so your PPEs when needed. And usually it'll be posted outside the patient's room what you need to do, or in the chart to tell you that the patient has snares or whatever, and utilize transmission-based precautions. So, acquired immunodeficiency syndrome, AIDS. It is caused by human immunodeficiency virus, which is HIV. The young homosexual men and IV drug users are at a higher risk, and they're in a higher risk population. So those affected are at greater risk for opportunist infections. So their immune system is very, very weak, and they get pneumonia really easy, Kaposi sarcoma, all kinds of different pathologies due to the decrease in their immunity. So, degenerative disease. Diseases caused by deterioration of the body may occur following a traumatic injury, regardless of age. It's just a normal process of aging, and factors that affect the rate of aging is atherosclerosis and osteoarthritis. So, there's metabolic, which is a disease caused by the disturbance of the normal physiological function of the body. So endocrine disorders and disturbance of fluid and electrolyte balances. So endocrine disorders, there's hypersecretion, insufficient secretion, there's a fluid imbalance, dehydration, and there's homeostasis. Traumatic, so a disease that may result from a mechanical force such as crushing or twisting of a body part, or from the effects of ionizing radiation to the body. So yikes. There's fracture, wound, and bruise and contusion that can show the effects of a traumatic injury. Neoplastic. So diseases result in new abnormal tissue growth. So it can be a lesion. You hear that a lot, as if they have a lesion. So that means we don't know quite what it is. So we haven't gotten as far as to see if it's benign or malignant. So benign means it's not cancerous, where malignant is cancerous. And then we look for metastatic spread. It can be through blood, lymph, and it can be invasive in going to other organs just from growing. And it can send seeds out through blood and the lymphatic system. So within neoplastic disease, there's cancer, carcinoma. There's primary diagnostic modalities, primary treatment modalities, curative, and palliative. So the different ways that we look at it. A neoplasia is from the Latin word for new growth. It is defined as an abnormal proliferation of cells that are no longer controlled by the factors that govern the growth of normal cells. It may be benign or malignant. And here's your summary of terms for alterations in cell growth. So you have atrophy, which is reduction in the size or number of cells in an organ or tissue with corresponding disease, decrease in function. Whew. Hypertrophy, so increase in the size of the cell. Hyperplasia, increase in the number of cells. Dysplasia, loss of uniformity of the individual cells. Neoplasia is ungoverned abnormal proliferation of cells. Oncology is the study of neoplasms or tumors. Benign is a growth which closely resembles its cell of original structure and function. Malignant is neoplastic growth that invades and destroys adjacent tissue structures. Metastasize is malignant neoplasms that travel to distant sites. Carcinoma is a malignant neoplasm of epithelial cell origin. Anaplastic is differentiated cell growth without form. They're very bizarre. And sarcoma is a highly malignant tumor originating from connective tissue. So benign is well-differentiated cells with uncontrolled growth, and malignant is loss of control of both proliferation and cell differentiation. Metastatic spread, it can be through the blood or the lymph system, and a lesion is many types of cellular changes that may occur in response to disease. And if we look here, we have a cancerous agent hits a normal cell, and there's changes in the DNA, and it can go to repair itself, or it can change its DNA and produce a metastatic tumor. Okay, for unregulated cell growth and differentiation to neoplastic cell. Staging of cancer. So we use the TNM system, and it's from 1950. T stands for tumor, N is node or lymph node involvement, M is metastasize. So additional numbers indicate the extent of the malignancy. So we usually use 0 to 4. 0 means that no, there's no invasion. So usually the tumor size, we give a 0 to 4. You can't really have a 0 tumor size, so I'm not sure. Usually 1 through 4. Your node involvement, now that can be 0. You have no lymph nodes involved, which is great, and no metastases. But if you hear that there's stage 4 cancer, that means that you pretty much have a large tumor that's invaded your lymph nodes and has metastasized. So they do the TNM system, and each one gets a number. So staging of cancer, we look at the type and the grade, and we rate it from 1 to 4. And we look for lymphatic or venous invasion. We look at the residual tumor classification, and we look at the facility treatment planning. So everyone meets. It's usually a tumor board, and everyone comes together from pathology to radiation therapy to radiology to all the people administer the chemo. It's a big deal. So we look at the system here. So we look at the TNM, and we look at all the imaging, and everyone decides what is going to happen. So we look at the prognosis, and everyone talks about the results, and we figure out how we're going to treat the patient and if it is curative or if we're going to provide palliative care. So here's your terms. And we have lymphatic spread, so major route in carcinoma to metastasize. There's the hematogenous spread, genesis, so malignant tumors that have invaded the circulatory system and travel as a neoplastic emboli. There's grading, so assessment of aggressiveness and degree of malignancy, staging. So we look at one, the extensiveness of the tumor at the primary site. We look at the second thing is the presence or absence of metastases to lymph nodes and distant organs. And the epidemiology, the study of determinants of disease events in given populations. Morbidity is the rate of an illness or abnormality occurrence, and mortality reflects the number of deaths by disease per population. And our terms here for disease, we have signs, which is a measurable or objective manifestations, symptoms, a feeling that the patient describes, it's subjective. So asymptomatic without subject or objective manifestations, so the person has no idea that this is happening within their body. The diagnosis is identification of the disease process. Etiology is the study of the cause of the disease process. Idiopathic is the underlying cause is unknown. Prognosis is probable patient outcome, what we think is going to happen. A syndrome is linked combination of signs and symptoms. Eradogenic is a disease caused by physician or treatment. So if we put in a chest tube and we puncture the lung, yeah, there we go. Nosocomial infections are contracted from a facility. So if they're in the hospital and they get MRSA, that is nosocomial. And there's community-acquired infections. So contracted in a public setting outside the healthcare facility. In conclusion, technological advances in medical imaging are changing how people are dying. So people are living longer due to all the advances that we have in medicine, along with all of our scanners. So we're able to diagnose patients earlier, which is pretty amazing. So best treatment for each specific disease process is made by combining medical imaging and other diagnostic and therapeutics. So radiation therapy, PET imaging, all of that is making a huge impact on how long people are living. So the role of diagnostic imaging in diagnosis and treatment is key. We diagnose almost every patient in a hospital. So don't take your role lightly. Know your pathology, understand your pathology, understand what the patient's coming in for, and make sure that you can provide the images so they can diagnose the patient, so that they can treat the patient as early as possible. If we can catch something early, the prognosis for the patient skyrockets. So we want patients to live and have a beautiful life.